Dear students, welcome to my YouTube channel. Today's physiology is tomorrow's medicine. I am Dr. Rekha. I am going to again crack a MCQ from the physiology topic. So the question is, during the continuous strain phase of Valsalva maneuver, which of the following changes is observed? The options are option A, increase in venous return, option B, decrease in arterial pressure, option C, decrease in heart rate, and option D, increase in cardiac output. First, we will see what is Valsalva maneuver. The Valsalva maneuver is nothing but the forced expiratory effort against a closed airway. It is done typically by attempting to exhale the air while pinching the nose and closing the mouth. So this is the picture showing a man doing the Valsalva maneuver. So the uses of Valsalva maneuver and phases will be explaining later. So coming to the phases of Valsalva maneuver involves four physiological phases. The phases are phase 1 is straining phase, phase 2 is continued strain phase, phase 3 is a release, and phase 4 is the recovery phase. So in this picture where I'm going to explain about the phases, forget about these parameters now. So here the girl is inhaling the air and against the pinched nose and closed mouth, she is starting exhaling. So this comprises the phase 1 and phase 2 of the Valsalva maneuver, that is the straining and continued strain phase 4 of Valsalva maneuver. And in phase 3, there is a release, that is she is exhaling the air, that is a release phase of Valsalva maneuver, and phase 4 is the recovery phase. So inhaling and exhaling against the closed airway is comprising the straining, and holding the air for 15 to 20 seconds forms the continued strain phase, and the releasing of air forms the phase 3, and recovery phase forms the phase 4. So in the Valsalva maneuver, if you see what is going to happen during the Valsalva maneuver is build-up of the intrathoracic pressure. So increase in the intrathoracic pressure will start compresses the organs and the vessels within the thoracic cavity. So it can lead to the aortic compression. With further increase in the intrathoracic pressure, we can expect a decrease in venous return. So these are all the main events which is going to happen in the Valsalva maneuver. Based on this, what is going to happen in blood pressure and heart rate is important. So in the slide, I am going to explain about the phases and the events. So in the phase 1, the staining phase, the main event is because of the increase in intrathoracic pressure, there is compression of aorta. The compression of aorta will lead to increase in blood pressure. This is sensed by the baroreceptors and it produces the decrease in heart rate, that is reflex bradycardia, followed by the continued strain phase. Here, because of the further increase in the intrathoracic pressure, there will be decrease in venous return, followed by, because of the decrease in venous return, there is a fall in BP and it is compensated by reflex tachycardia. The phase 3 is release phase. Here we are going to exhale the air now. We are experiencing a sudden drop in intrathoracic pressure. As there is a decrease in the intrathoracic pressure, usually we expect a increase in BP, but again what is going to happen here is a momentary fall in BP. This is explained by the fact that time taken by the blood from the pulmonary circulation to reach the systemic circulation is longer. This causes a momentary fall in the BP here, which is compensated by reflex tachycardia, and followed by the recovery phase. In the recovery phase, what is going to happen is there will be further increase in the venous return. Because of this, the BP is going to overshoot like this, and the heart rate is going to decrease. So based on this, it is evident from the graph. This graph is having the Valsalva maneuver 4 phases. So in the first phase, in the staining phase, there is increase in BP compensated by bradycardia. And in second phase, there is a decrease in BP and compensated by increase in heart rate. In phase 3, there is a decrease in BP as compensated by increase in heart rate. And finally, in the fourth phase, increase in BP is compensated by decrease in heart rate. So these are the changes that is happening in the 4 phases of Valsalva maneuver. Based on this, what is the use of Valsalva maneuver is it is used to assess the Baroreceptor reflex integrity, autonomic neuropathy like a diabetes mellitus, and in supraventricular tachycardia termination. I will explain how this Valsalva maneuver help in all these conditions in my further presentations. And based on this, now you can answer this question. During the strain phase, that is phase 2 of the Valsalva maneuver, which of the following changes is observed? Because in the here the intrathoracic pressure is going to increase much. So definitely option A is wrong because there is decrease in venous return. So decrease in arterial pressure is a correct option. Because of the decrease in venous return, there is a decrease in arterial pressure, and option C is incorrect because there will be, because of a decrease in arterial pressure, there will be increase in heart rate by reflex tachycardia, and because of the decrease in arterial pressure, there will be decrease in cardiac output. So the answer is decrease in arterial pressure. So students go through the phases of Valsalva maneuver in detail. So the questions can come from any phases of the maneuver. What is the parameter changing? They can be asking in the NEET PG questions. All the best. Thank you, and kindly subscribe the channel for the further videos.